So today we are going to talk about chronic pain, and we are going to talk about what are alternative and complementary medicine, what is their mechanism of action, which part of the brain they affect, what are the neurochemicals which are affected by it, and also how good they are. We're going to talk about primarily four modalities. First, we are going to talk about chiropractic. And again, the message is that continue your modern medicine treatment. Do not stop. Ask a qualified medical practitioner about the advice. However, because chronic pain in modern medicine is painkillers, which can have side effects on prolonged use, it's worth thinking about other modalities. The first one we're going to talk about is chiropractic. When we think of primary mechanism of action, chiropractic causes spinal adjustment and neuromechanical modulation. And if we think of the neurochemical effect, then it causes increased beta endorphins, increased serotonin, and increased dopamine, all of which have a pain relieving effect. Also, it causes a decrease in the cortisol, and that is an indirect effect. If we think of the neuroanatomical effect, chiropractic alters the spinal reflexes, and it also affects the brain areas like prefrontal cortex, which is inhibitory area of the brain, and also enhances the vagal tone. The next thing we're going to talk about is acupuncture. And if we think of acupuncture, primary mechanism is neurochemical modulation via acupoints, which are the pressure points, and you can use it through the needle in the typical acupuncture, or in acupressure you can use physically pressurizing these areas, although the effect is differential. The needle or typical acupuncture having a better effect. However, people use acupressure as surrogate marker. When we think of neurochemical effect, there is release of beta endorphins and enkephalins when you use the acupuncture, and people also found release of the serotonin and norepinephrine, and these together combine to give a degree of pain relief. When you think of neuroanatomical modulation, it activates the PAG and hypothalamus and thalamus, and together it brings the effect of the neuromodulatory pathways and also alters the default mode network or DMN. When we think of anti-inflammatory pathways effect, it suppresses the neuroinflammation via glial inhibition and cytokine reduction. When we think of Ayurveda, Ayurveda uses doshas, and there is balancing dosha, which helps through a complete different mechanism, bit more natural. However, you can also use herbal pharmacology, which can help modifying the pain pathways, and also detoxification on panchkarma, which helps. When you go deep into it to find out the neurochemical effect, there is modulation of NF kappa beta or nuclear factor kappa beta, and also inhibition of COX-2 inhibitors, which are pain modulating chemicals. And also the cytokines are affected by turmeric and other phytochemicals or plant-derived substances. Now, if you think of the neuroanatomical effect, it enhances the vagal tone and affect the enteric nervous system and HPA axis or hypothalamo-pituitary axis. If we think of anti-inflammatory effect, herbs like turmeric inhibit COX-2 effector, and there are other herbs as well. They affect LOX effector, COX-2 inhibitor, LOX inhibitor, TNF alpha inhibition, and also IL-6 inhibition. And there is also panchkarma having a detoxification effect. So this is how I'm explaining this science, which is there. However, for years and decades and centuries, people have not explained it in this way, and you are lucky to hear it in a very scientific way. And this is a proven way. If you think of yoga, it is a mind body regulation through the postures, breath, and mindfulness, and it causes calming of the body systems. And there is breathe, which is there, which increase oxygenation to the brain and helps in the rebalancing of the neurochemicals. So if particularly if you think of the neurochemical effect, there is increased GABA in the experiments, increased dopamine and serotonin as well, which all have a positive effect on the brain and also reduce cortisol. If you think of the neuroanatomical area where it affects, it modifies the insular cortex and also modifies the hippocampus in positive way, so that these are the centers where the pain pathways are affected. There is also effect on hippocampus, which is the emotional brain, and also effect on the prefrontal cortex and anterior cingulate gyrus. And these are the executive parts of the brain or executive functions of the brain which are affected. And therefore, using yoga not only reduces pain, but also increases the concentration, also increases the performance. If we think of the effect on inflammation, yoga has proven effect on reducing the systemic inflammation and also enhance the immune modulation, particularly the T cells. So if I just find out and summarize that chiropractic, acupuncture, Ayurveda, and yoga all have positive effect in the chronic pain, particularly backache or chronic arthritis, etc. And the effects are in neurochemical, neuroanatomical, and in anti-inflammatory pathways. And I have discussed these in details just now. Thank you.